to Johannesburg and speak to Netsengpeng Motema. Good to see you. First of all, the official number of cases in South Africa has now climbed to 116. How is the government responding to this?
Well, government is actually enforcing an order that was announced some days ago that schools should shut down, universities should shut down. So the school behind us, it seems, has heeded the call, and many other schools have also done so. But most worryingly for many South Africans is with the spike in numbers is the local transmissions, because the Minister of Health says that some of the people that have tested positive are people that don't have a travel history, because initially when the first cases were detected, it is people that would have gone abroad, upon coming back had been tested, those that they had been in contact with tracked down, also tested, and people went into self-isolation. But now people say with the local transmission, how easy is it going to be to track down people, especially because in this country, a lot of people to get around rely on crowded public transport, a crowded public transport system. And also where people live, a lot of people live in densely populated areas where access to water is a challenge. It's not always that people have water in their homes. People rely on communal taps, and practicing a healthy hygiene is not always possible. And now check this. Also, South Africa is very rural in large parts, which means people still go to water wells to carry and to fetch water. Some walk long distances. So if I go and get a 20-liter bucket of water, bring it home for cooking, for drinking and other things, people feel that to wash hands regularly might be a waste of water, but honestly, it is a necessity at this point, and a necessity that could save one's life.
Netsengpeng, and another strand, a big issue of concern is, of course, the fact that South Africa has one of the biggest populations living with HIV and also tuberculosis. What do we know about how the coronavirus will impact people living with these underlying health conditions?
Scientists have already warned, and actually yesterday there was a meeting with the Minister of Health where worry is being raised that people that are infected with HIV, for instance, that they will be vulnerable. And that's because in this country, in public hospitals, there tends to be a shortage of medication. Someone can go to a local clinic, and when they get there, they don't have tablets because they're out. And so there is worry that those people will be there will be an increase in vulnerability, which means there's going to be a need for more testing. Then there is a worry about a capability and availability of testing kits in this country, because already public and private hospitals say that they are inundated. Now people have been advised that stay at home as much as you can, but people have to go out and earn a living. People don't have access of money to buy stockpile. A lot of poor people. South Africa is a country that has high levels of inequality. It is the country of the haves and the have-nots, the have-nots and the have-nots. And the have-nots have not been able to go and stockpile. The rich people, middle-class people, have been able to go and buy pretty much whole stores and left shelves empty. Poor people are stuck at home, and they won't be able to go and stockpile, because generally people buy food for tonight, buy food for this week. They cannot buy food that's going to last more than that.
Indeed, and that is such a big concern. Not everybody can plan and stockpile food. Netsengpeng Motema in Johannesburg, really appreciate that update.